So we'll go ahead and get started. Tonight's mental wellness chat is on navigating complicated emotions. And we are going to talk a little bit about, just really life can kind of really create some of these and that, these complicated emotions to happen, but then also disease can too. And so, but we're going to talk more about, how do we handle them? How do we manage them? How do we navigate them? So we'll move on to our next slide. And I wanted to say a big thank you to our sponsor, Viatris. They have been sponsoring us all this year for our MS Mental Wellness Chat. And without their support, we would not be able to have funding to have this program. So I'm incredibly thankful. And I always like to give credit to MS Visa News for their bringing this program to the MS community. We started it during COVID and we kept it going. So we realized that people really do need this resource and support. And it helps for people that live in rural areas as well as metro areas too. It's just been a great resource, a great community for all. Okay, we'll move on to our next slide. So this right here is some positive affirmations. So I want you to take out your phone, if you have your phone close to you, and take a picture, or if you have your laptop, take a screenshot actually of this. That might be a little bit easier. So we're going to go through the positive affirmations. I talked about affirmations a couple months ago, and I had someone that wanted some of the affirmations, and so this is my way of kind of living up to that promise. I wanted to get them to you. So so the first one is, I am resilient and I can face each day with strength and courage. My body may have its limits, but my spirit is boundless and powerful. I embrace my journey, knowing that I am capable of adapting and thriving. Every step I take is a victory, no matter how small it may seem. I am worthy of love, care, and understanding just as I am. So if you can take a screenshot of those, I think it's good to have some examples of positive affirmations, things that you can say to yourself, for yourself, daily. And sometimes we need to hear those things. So we're going to move on to our next slide, and we're going to start talking about complicated emotions. So what are complicated emotions? In some essence, every emotion is kind of complicated, I think, to some degree. So, but our complicated emotions they're complex because they are related to events, to thoughts, to relationships. And they also often involve a mix of feelings. So that's part of the reason it can feel complicated too, because you might not feel just sad about something. You might feel like angry and sad, or hurt, or lost, and so often has a mix of feelings. And this usually is triggered by changes or a challenging situation. So it might be changes in like loss, illness, significant life changes. All those things kind of go along with having MS, as well as any chronic disease. And actually, all those things go along with living in life. And so examples would be grief is very complex sometimes, shame, frustration, confusion. And these are all a part of the normal human experience. One of the things I think that it's important to say about complicated emotions too is that they often can look like, one thing, but they can actually be something else, or a derivative of something else. Like often anger is really another emotion that's speaking. So we might feel very sad or very hurt. And because of that, we feel very angry, but what we show is the anger, but inside we're actually dealing with a lot of hurt or frustration. So emotions can just, generally be complicated. So let's talk a little bit about the common triggers of complicated emotions. So we'll move on to our next slide. And so major life changes. So if you've had any of these triggers to complicated emotions, feel free to just say yes in the chat box. Major life changes, such as illness, job loss, or divorce. Can many of you remember when you were first diagnosed with MS, like all the different emotions that you had and the feelings? and that you probably still, some of those feelings have probably tapered, and some of them might come back, especially, you know, if you have been back in the hospital, or if you've had a relapse, or other things going on, or if you had to make treatment changes, etc. But also long-term stress, so like financial issues, and even caregiving. So I don't know if we have any care partners on here, or spouses. I always call my husband a caregiver, but he's not technically, but he is, because he partners, he helps with parenting, and helps to do things that actually lightens a lot of my load, and always has. Also, common triggers can be unresolved conflicts, relationship issues, past traumas, and then emotional fatigue. So things like having a chronic health condition such as MS can be a trigger of some complicated emotions. And so we're going to read a little bit in the box here. Let me get to it. We have Linda say, is fight or flight a syndrome of emotion, maybe? Flight or fight is a response that we have when we are feeling, when our parasympathetic nervous system is impacted, and so or we're very stressed. We talked about that in that stress cycle. I remember this, and so it gets activated, and so I wouldn't say it's actually an emotion, but I do think it comes from an emotion, because fight or flight is like the initial thing that we do before as we respond to something. So we might lean into it. And it comes with emotions, definitely. So as you're deciding the fight or flight, your chances are you might feel anxious or stressed or excited in a good way or a bad way sometimes. So it's kind of like follows with an emotion afterwards, but it's not necessarily a emotion. Paula said yes, yes, yes. Illness, job loss, divorce, all at the same time. Yeah, a lot of complicated things going on all at once. Katrina says yes, breakup of a 13-year relationship, raised a son, moving out next week. It's incredibly complicated. That's a big change, and it could lead to good, positive things later, but right now that might not change it, because it might be hard and difficult. Jane says plus, 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 which makes me think that yes, yes, yes to all these things. I want to say that David says yes. Paula says relationship issues, yes. Then Tina says, my husband was recently diagnosed with bladder cancer. They were able to get it all, thank goodness. I was an emotional mess. So, and that is, one important thing too, is that, when we think about MS and the emotions and the ups and downs that we have with the disease, well, the people that we love and the people around us, and even sometimes our partners or our family members, still, they get sick too, and so they get their own version of disease that we have to help, and that makes it complicated, especially when you're living with a chronic disease. Kingsley said, oh gosh, yes. And David said, I remember when I was 14 years old. And then Linda says, I can totally relate to spouse getting ill. Yes, absolutely. So there's a lot of different triggers to why we have complicated emotions. And even if you were, digging back to your past, you might think of some, complicated relationships that you've had that maybe were not ideal, that you realize that you just, as you work through them or talk about them or think about them, reflect on them, that they bring up a range of emotions that are could be anywhere from like, I really loved the person to I was really angry at them, I was really sad, or etc. It can be really, it's really confusing. So that's one plug for therapy is therapy can help you kind of sort of clean up, or not fix, but kind of clean up and kind of so we can understand the space of some of the emotions. So let's talk about recognizing the signs. We'll move on to the next slide of complicated emotions. So here are some signs. They're not going to all be like completely inclusive of a list, but so you may have some. We're going to break it down to like emotional, physical, and behavioral. So emotional symptoms. You may be feeling stuck or overwhelmed. You may be feeling irritable or having mood swings. You might have trouble relaxing or enjoying activities. I think some other emotional symptoms. I know for even myself, when I've experienced complicated emotions, that sometimes I have a hard time moving forward. I'm sort of stuck. And I guess that was the first thing, feeling stuck. Can you guys relate to feeling stuck? Like I feel stuck emotionally, and then I have a hard time because I can't quite pin down what exactly all the things that I'm feeling because it's a lot. So Natasha says all the above. And then Kanita said, I was actually glad to have a name for what was wrong. Yeah. And then Amelia said, yes, I can relate. So so those are some of the emotional signs. And there's definitely, if there's other signs that you're, that you feel, this is not all inclusive lists here. But then the physical symptoms, you may feel, when we are feeling stressed, and when you're having complicated emotions, it is like stress for the body and the mind a little bit, and it's hard. So you may feel a little bit more fatigued because it may make you feel kind of sad or frustrated or confused. You may notice changes in your sleep or your appetite. Those are important to pay attention to. Now, when we're paying attention to our sleep patterns, kind of have the idea, what are your sleep patterns in general? And then has there been changes to that? Because sometimes I even remember when I was practicing as a therapist full time, I would ask people about their sleep and they'd be like, I haven't slept all, I wake up at, 4 o'clock every morning. And I can get to bed at like 10 and then I wake up at 4 and then I can't go back to bed. Well, that's their pattern. So that's not a change. So being aware of any changes, a change would be is that you can't fall asleep at 10 or you wake up at 2 and you can't you can't go back to sleep, or you're just waking up a lot at night, and just kind of paying attention to the patterns. The other physical symptoms, so fatigue, headache, digestive issues, changes in sleep or appetite, and this may even lead to some, just feeling like a little bit of change in how you're feeling physically with your MS, because it's actually a lot of stress. So we have Amelia said that she could relate. We have Linda says, I keep replaying it over and over until I process it, and then I can let it go. Good. We're going to talk about like some strategies too for working through things as well. And then Sherry says, yes, I can't ever say the right thing. It is really tough when you're in that space. Kingsley said, definitely it's like being stuck in a vortex. And Ellen said, thank you. She said, Jessica, you speak really well. I have a difficult time at times. It's Ellen. Thank you. And you're Ellen now. So, so I won't, I know it's Ellen now. Yeah, so so I think we all can identify these periods of time that we have these complicated emotions. Well, behavioral signs, so things that actions might be, you might feel like you're withdrawing from social activities or withdrawing from things that you normally would do. So if you normally like to do something, you might not really feel like doing it. You might feel kind of a little bit more apathetic, a little bit more hard to engage in those things. You might have difficulty concentrating or even making decisions. Again, it's that idea of feeling stuck. So we're going to move on to our next slide. Can you identify any complicated emotions and symptoms during those trigger times? So that's a very wordy way of saying that. That probably doesn't make a lot of sense. Let me reword this. Can you identify like somehow a way that you feel when you have like a trigger time that could make complicated emotions happen? Like, for example, I gave the example of feeling kind of stuck. I have a hard time, like I just really have a hard time, like just I feel stuck. And when I feel stuck, I don't have a lot of energy and I don't want to do a lot of things because I feel sort of emotionally stuck, but then that makes me feel kind of like physically and behaviorally a little bit stuck too. Also, I am not as emotionally resilient feeling. So I feel, just a little bit more kind of internal, keeping things to myself. We have Natasha that says, feeling sorry for myself because most of my family doesn't understand. We're going to talk a little bit, thank you for sharing that. We're going to talk a little bit about how to communicate, and how to talk to, how to kind of try to foster as much empathy and compassion as you can when you're talking to someone about a complicated emotion. Because I think that's an important thing that we can be empowered to learn today, is like, what are some ways that we can talk about it? Because most of the time when we feel that way, if you feel your emotions are complicated, chances are it's going to be really hard to explain to someone else because you don't quite understand them sometimes. And then when you go beyond that, it's hard for like the people that that care about you to understand too. So it's important to kind of to be able to process it and kind of start to understand it. We'll talk about strategies too. So Terry said, Sask at Chuan. So please explain that, because I don't understand, but it might just be me. Or maybe it's that you just kind of like, you kind of sit to it and you kind of chew on it and kind of think about it. Maybe that's what it is. Amelia says, my husband often asks, what's wrong? And I can't answer that easily. Makes me want to withdraw. So we'll talk about some strategies. Like sometimes we don't know what's wrong, and maybe we're trying to figure it out. And it's okay to say, you know what, I'm kind of working on it. I haven't been able to really figure out how I'm feeling. And so maybe that might allow space to talk about it. I know that sometimes I can talk with like friends or my husband, talk through, and sometimes that processing helps. And then sometimes I just need to do it on my own. And then I circle back and say, okay, I realized what was going on. Sherry said, very important and not needed right now. So it's, it's really important that we I also identify, when we're experiencing complicated emotions, how are we feeling? Oh, this might be a complicated emotion. I think when I feel stuck, I'll a lot of times I'll think, okay, I've got something going on. So I want to give you an example, and please tell me if this has ever happened to you, because I think to me this is a really great understanding of complicated emotions too. Have you ever had something happen in your day? Say that you went shopping and you had or just went to the store and you had a poor interaction with someone. Someone was kind of mean to you, like during COVID, this happened to me once, where someone, well, people are mean in general sometimes, but somebody was mean. And I remember, like, as I was carrying on the day, I just felt sad. Like the person was mean. Nothing happened. I left and it wasn't a big deal. But then I just remembered later, I was like, I'm sad. I wonder why I feel sad. Has that ever happened to you, where you had an emotion, something happened, and you're like, why do I feel sad? Or why do I feel angry? Why do I feel frustrated or whatever? And then you think about your day and you're like, aha, that happened. And I need to give that space to kind of think about that and process it, because that clearly hurt my feelings, or that made me feel bad. So we have Joe that says, I feel my worth is what I can do. So now that I can't do anything, I have no self-worth or purpose. And so, Joe, it's very like a very complicated feeling. I want to challenge you, Joe. And I know that this is really hard, but I want to challenge you, because I feel like you're on here every month. To make a list of all the things that you can do, the small things, little things. It might not be working. It might not be walking. I'm not sure, because I haven't seen you face to face. It might not be certain things, but I do know that there definitely there are things that you can do. I think you're pretty amazing. You come on here every single month and you participate, and you participate really well. And so I want to give you that challenge. But does anyone else, can they identify with that kind of feeling like their worth is tied to what they can do, and now if things change that you can't do, and then you feel like that you don't have as much self-worth? That is I think if you're feeling that way, that's always a good space, to work on within counseling too, because they can help to identify the things that you can do. Purpose, I think it's pointed too much towards a job, and that's so unfair, because purpose, we're so much bigger than that in the work that we do, even though we can identify with that as well. Linda says yes. Katrina says yes. Paula says, I used to think about what happened until I processed it and let it go. Good. Terry said yes. I think that's their problem. I pray for them. Terry said yes. And Natasha said me all the time. Kingsley said, absolutely, you're not alone. Katrina said yes, and it's very difficult. Eventually finding things like you say that I can do, even if it's for 5 minutes. So Katrina, I'm sorry, Joe, this comment is for you. Eventually finding things that you say that I can do, even if it's for a little bit. So it's kind of a reframing, but it's the truth too. We often do a lot of things that we don't give ourselves credit for. And I sometimes in different programs for different topics, I'll say, if you're using a to-do list, I'm a to-do list person. So if I showed you my planner, you'd see a to-do list more than likely. And but there's days that I'm really tired, and some days I work very slow, and my pace is very different, and my productivity is different. I still work, and I'm still productive in some senses, but not nearly as productive as I am on the other days. And so on those days, I'll turn my to-do list into an I did list. It's a reframe. It's instead of looking at the things I didn't do, I look at the things that I did do. So I acknowledge all the small things. Like I might have sent a couple emails that were really important, or I might have did something that was a lower energy task, but it was still important, but I normally wouldn't give it credit. So we have Kanita here that says, when I'm asked, why didn't you do ... like whatever, it adds panic about the time pressure to whatever I was feeling before. I bet other people would agree with that too. So when you're asked, why didn't you do such and such, and so I think that I did list can be very helpful, and a helpful reframe. Because it can be, it is a complicated thing to kind of answer, and can kind of complicate more of your emotions. So we're going to move on to our next slide. So why is it important to manage emotions? If we don't manage the things that we're feeling, then it just leads to more feelings. For example, it can lead to increased anxiety and stress. It can, and if you've been participating in the MS Wellness Chat, I talk about this a lot. And if you're new, you might know this, but I will talk about this a lot. And is that stress is bad for our bodies, and emotions aren't bad for our bodies. Emotions are good. They teach us things. They tell us things. They give us opportunity to work through things. So emotions are good, but learning to manage them are really important, because if we don't manage them or work through them, then they sort of stay there. And if they stay there, they end up becoming bigger and have more weight, and that can create more stress, and that's really bad for our bodies. If you're, living with MS or living with, any chronic condition, you want to have as much anti-inflammatory properties in your body, but stress is super, inflammatory. And guess what? Stress is everywhere. So that really stinks, right? We can't control the stress is there, but we can manage our stress, and we can manage our emotions. So what can happen, unmanaged emotions can lead to, physical things like high blood pressure, weakened immune system. Many of you can experience, including myself, a time that you had a relapse with like a pseudo relapse or a relapse with your MS, and you can kind of connect it to a time that was incredibly stressful. So I'm going to read a little bit, 2 more points, and then I'm going to read some of the box. So if we don't manage our emotions well, then it can be hard because we might have difficulty maintaining relationships. It also, not managing our emotions can just make it hard on a day-to-day to have emotional wellness. And so when we do manage our emotions, and it improves our mental well-being, our clarity, and our resilience, which are all things that we talk about quite a bit. I'm going to read a couple of things that people said. Katrina says, I do have a to-do list, and now list even the things and cross them off. So at the end of the day, I can look at what I did cross off and feel some accomplishment. Absolutely. So that can be a really great thing to do. Is to cross them off. What happens is when you cross something off a to-do list, you get a boost of dopamine. But if you look at your to-do list and you don't have anything that you can cross off, I want you to think about, did you get up? Did you take a shower? Did you change your clothes? Did you go to the mailbox? Did you run an errand? Did you, think about, did you call a friend? Did you, for me, I loathe doing the dishes. I didn't say love, I said loathe. I don't like it. And so did I do the dishes? Because we won't have any if I don't do them. And so, making sure that you check off the things that you did do that you normally wouldn't have on that list. Okay. And thank you, Joe. Amelia says, yes, when I retired, it made it extra hard. Your chat on upward spiral was helpful to me. Thank you, Amelia. So we did have a chat, mental wellness chat. It was on the upward spiral. And essentially, it was it's a really great one that you can go back and look up on the YouTube channel. But we talk about like the small things that you can do that give you honestly like little psychological wins or help to engage with your neurotransmitters. And when you do that, like it engages with dopamine or goodness gracious, your other endorphins. I'm just kind of blanking. Oxytocin, et cetera. And so, but because you do that and you have a little like a little lift, it can help you do the next thing. It's very small, but those subtle small things are really important. Ellen asked, how do I sign up for this again? So I want you to know, we're going to go until 8 o'clock tonight, but how you sign up, if you're on already, you are signed up. So you will check your email box. You will get an email every month on the topic that's coming up, but I always announce what the topic is. We are usually a consistent day of the week and evening of the week. I feel like it's a Wednesday, like third Wednesday of the month usually, I think. And so, yes, no, Thursday, is it? My goodness. I've been traveling, so it's Wednesday. Okay. So, so please continue to come. Okay, so we're going to talk about strategies now. Let's move on to our next slide. Okay, so strategies for managing these complicated emotions. The first thing is to acknowledge your feelings. So how can you acknowledge them? Let's talk about some ways. So one way is writing, journaling. That could be helpful. If you're unable, some people can acknowledge their feelings and their emotions very quickly and can identify them. Sometimes even you can look at like a feeling chart. You might have seen one of these at like a doctor's office a long time ago when you were younger, or in counselor's office in school. But just kind of looking at all the different faces, or even looking at the emojis on your phone. What emoji, what face am I kind of feeling right now? That might help you. But either way, finding kind of like identifying kind of what feelings you're having, what moods you're feeling. And if you're having trouble, identifying it, I think writing it or talking to someone can help, because as you process things out, and get it out and kind of think about it, you start to work through it a little bit. Doesn't mean you get over it. It just means that you start to work through it. And if you can work through it, then you can work on accepting how you're feeling, and acknowledging how you're feeling. Because if you were not human, you would not feel. And so I'm glad that you feel. And it doesn't feel good, I know, to feel certain feelings, but those feelings teach us things too. And so we can move through them. The feelings will not stay forever. And validating your feelings. It's okay to feel what you're feeling. If it's angry, mad, sad, frustrated, hurt, whatever, they're your emotions and your feelings and nobody else's. And so it is okay to feel them. And avoid suppressing them. I think we suppress them. We say, I just need to deal with this. It'll be fine later. I don't need to worry about it, or it's silly that I'm thinking this way. When you're doing that, you're being judgmental towards yourself, and you're actually suppressing them. And when you suppress them, your emotions continue to build. It's kind of crazy. If you think about it like a volcano, when you're like packing your emotions down, eventually the volcano is going to erupt. And so, so we want to make sure that we're not packing our emotions down, because they're so much easier to deal with if we deal with them as they're happening, instead of feeling like later I'll deal with this. And it's okay, if you have something in your life that, is making you feel a certain way, for it to sort of sit right here with you, and you don't have to love it or like it, but you can accept, I'm feeling grief right now. And I'm not going to, try to make it go away. It's just a part of what's going on in my life or whatever. And so, other strategies, practicing self-compassion. So treating yourself with kindness during difficult times, avoiding self-criticism and judgment. And I think it's important to, how in terms of practicing this, you could say, I'm going to be kind and gentle to myself. Think about how you would sort of support a friend or support somebody that you love. We often don't give ourselves the grace that we need, but we'll offer it to somebody else. And so to allow yourself to say, what, I'm going to give myself grace and kindness right now. Identify the triggers. When you recognize what situations or thoughts trigger your emotions, that can help you. It doesn't mean that you can keep them from happening, but at least it can give you some capacity to understand that that like certain things trigger certain emotions. So that way you'll have a better way of being able to understand and know how to manage things when your emotions are challenged. And then keep a journal or note to kind of I guess note your patterns and better understand your emotional responses. And don't be upset about how you respond to something emotionally. That is who you are. You may want to change or adapt, and you could work on that individually. I know for even myself, there's been things in my life that I, based on, small Jessica when I was younger, that I react certain ways, or I feel certain things. I might feel heavier about something that other people wouldn't. And I don't like that, but knowing that is actually power, because then that helps me to kind of understand myself, kindness and grace, and then find other ways to work with the emotion. So why is it important to manage our emotions? We'll move on to the next slide. I'm going to read some strategies in a minute, so don't worry about answering that chat box yet. Real quick, I've got something to. So Linda says, I need to lower my intensity when it happens. Yeah, I think that's a great thing to do. Linda, is that because if we're feeling big, and if the emotions are big, feeling big, it's going to take more space. And so I think internally giving yourself grace and saying, I'm, going to allow myself to kind of lower the intensity of how I'm feeling right now. I'm going to take care of myself, and that's, I think, an incredibly important thing. So we're going to talk a little bit about a couple of strategies beyond, actually I did talk about strategies. I'm sorry. Again, I was traveling yesterday. I got in this morning. I did take it out, but clearly I little bit myself today. So do any of those strategies help you, kind of like practicing compassion, like Linda said, lowering her, asking herself to lower intensity, validating her feelings? I know for me, journaling or talking to someone helps, kind of identifying the emotion, because usually if I can identify, I can work on releasing it, or work on just understanding it and being kind to myself. Do you have any strategies that work for you when you're managing a complicated emotion, like something that is hard to deal with? And also, working with a counselor, is a strategy too. Terry says, I do breathing exercises. Those are really a really great thing to do. Natasha says, I go to counseling once a month. Amelia says, it causes me, in parentheses, to be bitter and not nice person when I dwell on something or keep something in. I don't want to be that person. So yes, giving myself grace and thinking about what I'm grateful for. So giving yourself the opportunity to find a way to sort of like work through it and let it go. Because if you do hold it on for it, I think there's a difference between like holding the emotion real close and it's causing a lot of distress, and also letting the emotion sit there for a little bit. I think it's a kind of a little bit different, little separation. It's a little bit of, this emotion is not me, but it is here with me right now. And so stay with me for a little bit of emotion if you need to, but I'm going to not focus the whole time. When you wear it so close, it can be heavy. We have Kingsley says, yes, journaling is my go-to, and getting counseling from my pastor. And then Linda says, therapy by telehealth and avoiding my triggers. Absolutely, having good boundaries. And Paula says, yes, I journal and label what I'm feeling, and then I figure out what trigger came from so I'm able to release it. That is perfect. We're going to move on to our next slide. Now we're going to talk a little bit about communicating complicated emotions, finding ways that encourages empathy and understanding, because it's already hard enough to have a complicated emotion, but when we're communicating it, that can feel hard. And I believe it was Amelia, that her husband would say, what's wrong? And sometimes it's hard to know what to say. And sometimes, and I believe Natasha, somebody said something about their family not understanding. So maybe we can find ways that encourage empathy and understanding. So these are just a couple of tips. Before expressing your emotions, taking time to understand what you're feeling. So ask yourself what triggered the emotion and why are you reacting the way that you are. So it's kind of really taking a deeper understanding of the complicated emotion. When you're communicating, it's important to use I statements and focus on your own feelings, and rather than blaming or accusing others. So for example, I feel overwhelmed when I don't have a really good example right now, but I'll make up one. I feel very overwhelmed when I come home and the dishes are not done after I've traveled or something. That's usually not the case. Or I'm struggling with my fatigue when I get home and I don't have the energy to do some of the things in the house. Another thing is be honest and vulnerable. Allow yourself to be open about what you're feeling. Saying, I'm not sure how to express this is okay. And that can help to kind of clarify that emotions are complicated. Choose the right time and setting. Find a private, calm environment to talk about things when you're not feeling rushed or interrupted. I think it really is important. Setting, sometimes we don't have much time, but setting is important to kind of find the right space. I always try to not have really complicated parenting discussions like in the middle of the day during work with my husband. We both work remote, and because it never will go well because we're both busy and focus, very focused on what we're doing, and we're not giving it the good time and space that we need to. Keeping it simple. You don't need to explain everything all at once. So start with the basics about how you're feeling, and give the other person time to respond. And kind of acknowledging your conclusion. It's okay to say, I'm feeling a lot of different things right now, and I'm still trying to sort them out. It's okay to not know, because emotions can be complicated. And ask for understanding, not solutions. Sometimes you really just need someone to listen to you, not to fix things. You can say, I don't need advice right now, but I could use someone to hear me out. Now, I think it's important too that when you say that that you're leaving space. I do think sometimes it can be hard. When if you're talking about with your partner, with your loved one about things, and you're expressing your emotions about things, and then there's action steps too, and things that you can do that maybe can help you to feel better, or make things be a little bit easier for yourself. Like it's I think it's also important to note that when you want that empathy and understanding, but like also that your listener wants over a collective time to be there to be your listener, but they also want you to do some of the things actively that will help too. So it's kind of it's being an active participant too in that sense for you. But also use written communication if needed. If verbal communication feels too difficult, consider writing things down, or in a letter or a message. I cannot say that this is one of the best techniques when I was in therapy that I would work with people. One, often I would have them write a letter to the person that they would never give to them, just so they could get the emotions out and feel them and think about them and process them. Sometimes they could just journal, but sometimes writing the letter actually was very helpful and very therapeutic. And then sometimes we got to the point with communication, and sometimes even in the beginning, I've worked with couples before. It's not my strong suit, but with working with couples, having them write letters to one another, or if one person needs to really communicate something, but they have a really hard time talking about it, letters sometimes can be very helpful. And then being patient with yourself and others. Complicated emotions really take a lot of time to express and understand, and it's okay if the conversation you have with someone doesn't resolve everything immediately. Sometimes it's just a matter of processing and connecting. And then checking in afterwards, following up with the person to clarify any misunderstandings or provide more context as you gain kind of more insight into your emotions. So these are just some general tool strategies just to kind of help invite, empathy and understanding. And these things, I think are also very, they need reciprocity. They need equal things back and forth. Sorry. So they need, you need to be able to do this to some people in your circle, as well as expect this too. So you can model this behavior, but this is important for, for you to have, but it's important for them to have as well. And so always being able to have empathy and understanding in communication is important. So we're going to move on to our next slide. We're going to talk about coping techniques. So mindfulness and relaxation techniques are very helpful because they can bring you into your present. They can help you to relax, and sometimes that in itself can be something that can help you to kind of take emotion that was like sitting right there and to just move it maybe right there. So practicing deep breathing, meditation, guided imagery, mindfulness will help you stay in the present and reduces over that emotional overwhelm. So I'm kind of putting this analogy with emotional overwhelm. Cognitive behavioral strategies, challenging negative thoughts or reframe thinking. So you can ask yourself, is this thought true? Or how could I think about this a little bit differently? Also, physical activity. when you're engaging in exercise like yoga, walking, or stretching, that can be very helpful to release emotional tension. When we talked about the stress cycle and kind of releasing the stress, that's definitely a part. And I know exercise can be different from person to person and look different, but there can be different types of exercise for everybody. And so I'm going to move on to the next slide. I'm going to ask. We're going to talk a little bit about building emotional resilience. And so, so with building emotional resilience, you know, we've talked about this in the past, and I always talk about resilience because these are things that we can do to help promote more emotional wellness. And so, with when we're building emotional resilience, we are making sure that we are practicing gratitude. That we are and gratitude is not just about every day I'm or I'm searching these big things that I need to be thankful for. I think gratitude and building emotional resilience is finding small little things each day to be grateful for, like the tiny little things, and I do think that those make a big difference. I will share and feel free to share a small little gratitude actually in your in the chat box. I'll share mine, and it may or may not be comical, but I am incredibly grateful that my husband got me some chicken nuggets before this program. I ate them 1 minute before we got on, and I was starving, and it's not my go-to dinner. And but I was really hungry, and I was so thankful that I was able to get chicken nuggets this evening before I got going on this program. And so very small, very easy, nothing too crazy, and I'm very thankful for a nap today. So finding the little things that you're grateful for. Also building emotional resilience through allowing yourself to to take time to practice mindfulness, to practice breathing, to be in nature, to connect with positive people, to have good boundaries. And we'll move on to our next slide. So setting healthy boundaries are incredibly important, and this can help you with managing complicated emotions. How it can do that is that setting boundaries can allow you to avoid situations that trigger you, or that situations that purposely cause unhelpful emotions. We're going to move on. Next slide. And when to seek professional help. So it is so important to seek professional help. I would say if you are dealing with a lot of complicated emotions, if you're feeling stuck and you can't get unstuck, if you are, or if you're noticing that it's impacting your life, your activities, your sleep, your quality of life, your appetite, those are all really good times. You don't have to wait until it's horrible either before getting professional help. Counseling is good for when things are kind of okay, but you just need to process through things too. So so know that you don't have to do all these things alone. If you do need professional help, it is there for you. But definitely if you're noticing it, how it impacts your relationships, your quality of life, your interactions with others, that's when you would seek. We'll move on to our next slide. So managing complicated emotions takes, time and practice. Be patient with yourself and acknowledge progress, even if it's like really small. And know that emotional health is a part of your well-being, and seeking support is a sign of strength, not a weakness. I look at everyone that comes onto our mental wellness chat as very strong people. You're willing to be vulnerable. You're willing to connect. You're willing to be open, and that is a sign of strength. That's an empowering thing. It's a thing that you're doing actively, which is really cool. So we'll move on to our next slide. Okay. So as I promised, here's the next set of positive affirmations. So feel free to take a screenshot if you can. Or take a picture if you're looking at your computer, or you can go back to the YouTube channel when this is posted. So a second set of positive affirmations. I focus on what I can control and let go of what I cannot. My illness does not define me. I am more than my diagnosis. I honor my body's needs and listen to what it asks of me. Even on tough days, I'm surrounded by support and love. I have the strength to face my challenges of today, and I trust my ability to overcome. We'll move to the next slide. I have a question here, but go on to the next slide if you don't mind, because So we have Terry, who says, in a stressful situation, I like to tell jokes. I think that's a coping mechanism for many people. It can be helpful. It can be laughter. Laughter is good for us. And as long as we're, dealing with the stress, that's totally fine. Jan, thank you. That was good, Jan. Jane asked if I could give an example of a cognitive behavioral strategy. A cognitive behavioral strategy would be a strategy of how we change our thinking and how it can lead to different actions. So I'm trying to think of what would be in my best example coming off the top of my head. I would say that so if you're feeling like you are not worthy, actually, I did give I think a good cognitive behavioral strategy. If you're feeling not worthy because you're not feeling like you can do things or not able to do things, then a strategy you can put into place is one, asking yourself, one defining, is this true? Is this, a true thought? Is this a kind thought? Then you could help to reframe the thought. But also looking at kind of that I did list and looking at redefining things in a different way can help to redefine some of the strategies that instead of feeling like you were able to accomplish anything, that you are able to accomplish something. And then from there, that can slowly kind of help to change kind of your behavior, because if you're feeling like you're not able to do anything, you're less likely to try to do things. And so I'll come up with a better example in the future too, but there are lots of different cognitive behavioral strategies related to our thinking and how to kind of change our thinking and how our thinking patterns can be changed. There's a lot of power in reframing. There's a lot of power in doing things like that I did list kind of as a behavioral change that kind of changes some of the thinking of what we're doing. So I have someone that said they got released from a community mental health hospital because they don't have enough workers. I only have Medicare, Medicaid, and most won't accept. This can be a very challenging thing. What I'm going to do is, for this person, I want them to reach out to MS Views the News and see if they can link you, at least with me after the presentation, at least get me your email. Don't put it on here because I won't be able to get it in time. And maybe I can connect you to some resources, or Jennifer can connect you to some resources, at least to see if there's a therapist locally. Also know that the National MS Society has a really good program where they have navigators and they can help as well. So David said, never give up. And then Deanne says, instead of beating myself up for what I no longer can do, I acknowledge what I'm able to do. Okay, we're going to move on to our next slide. I want you to know that you're not alone, and that's incredibly important. I'm going to thank Viatris again for their sponsorship of tonight's program and MS Views and News. We'll move on to our next slide. So this is my classic, I'm not going to say goodbye. I'm going to say I see you later. This is a great community and we are doing great things for each other. And I wish you all very well in the next month. And I hope that you really do work on your complicated emotions, kind of letting yourself feel it. If you're feeling it here, see if we can move it over here, accept it, find some strategies to kind of process it out. Know that you're not alone, and we will see you next month. All right, bye.